Hello, everybody. My name is Kevin Kocek. I'm the founder and CEO of ChemicalQDevice, here to tell you a little bit about newsletter number 22. So this week featured a lot of hard work last weekend. Quantum's clinical papers with quantum technologies was thoroughly investigated, and specific solutions for each of those three papers I kind of focused on was sent to different university OIC, doctors, investor, incubator, and banker. Another kind of document that was created was the research aims for this very specific electronic health records area of research. And it was drafted based on academic papers and instructional videos and specific, and potential investors may be interested in this. Now, a lot of this is based on a couple weeks ago. I did 2 years, so 2020 through 2022, of medical and quantum research papers developments. And what I had found, and it's been published earlier, is basically there's a number of methods and analyses that have been formed in a framework that medical doctors would be interested in taking a look at. The reason why they haven't hit the news that hard is because the hardware is not awesome yet. But it lays the foundation for that. So this week was huge for the Southern California quantum computing discussion. Over 315 people and approximately 60 attendees came to this event, featuring Dr. Philip Nikolaev. And it was very interactive. The highest registration of any SoCal quantum event thus far. So another thing that I did is, over the course of these past 10, 11 months, I've collected a number of vendors, some of which that I've talked to, say, for instance, on Zoom or calls, those types of things, or some of them have been speakers on the discussion as well. So I put it together in 180 plus vendor connections to form a quantum vendor world map. So starting from left to right, obviously with D-Wave in Vancouver, and then there's a bunch of San Francisco Bay companies. So you have 4 kind of pure quantum companies, and you have Google. So it's very interesting to see. And then as you go across, obviously you have some Colorado, East Coast, France, Spain, some in Israel, China, most of them are blacklisted, and then also Fujitsu in Japan. And this is very helpful for what's going to be done in medical purposes for ChemicalQDevice, basically having an easy way to see what type of quantum technology, who's involved, whom I can reach out with fairly quickly. Now, I've been taking this Harvard Innovating in Healthcare class. It's over half done, so I'm on week 5 right now. Other startups would love this class, so just type in Innovating in Healthcare. It's a free class. You can pay for the certificate if you want. Now, in specific, what it helps with is, for startups like mine, it goes through case-by-case 6-factor analysis of companies. And this is how they're structured, how financially strong they are, how accountable they are they consumer facing, are they strong with public policy, and then what type of technology and how strong are they in the technology. So it literally simplifies a lot of these things into an easy to see color coded thing. And the end goal of it in healthcare is, will it do good and will it do well? So will it do good? Meaning, will it do good for this society over the course of time with health? And will it do well for the company financially? Some of the cases that we went over were based on pharma, weight loss, and insurance. So just a reminder, quantum is a government initiative. It's fully backed by the White House. The NSF has been working on it since the 1980s, or I should say funding it since the 1980s. They project a practical quantum computer by the end of 2023, next year. So the Navy, and this goes with the news as well, is that they're very focused on quantum networking, and they believe that there will be a quantum network nationally in the years to come. So again, this is Kevin Kocek, founder CEO of ChemicalQDevice. Have a good rest of your Friday and have a good weekend. Take care.